Welcome to another episode of season 4 of Dr. G at the Heart of Healthcare. We have a very special guest. I've been trying to get her on the podcast for a long time, Lori Cooper. Hello.
Hello, Dr. G. I'm so excited to be here.
So glad to have you here today. We are going to talk about what is palliative care. Don't get scared. Don't turn this off. You know, we're here to educate and empower. But we have Lori here. And we're going to learn about the program. So let me just jump into your bio real quick because you have a lot going on here. So Lori has she's currently, the director of partner relations and community outreach for Hospice of the North Coast. You may have seen us before. We went live on Instagram when we toured their Pacifica house in Carlsbad, right?
Yes.
Yeah. We did that. And Lori has, she's BSN RN, as you see, 30 years of experience in the healthcare industry. And she's just really passionate about educating and connecting people in the community. And it's always a joy to see you. And you're from Boston, right?
Yes, I am. East Coaster. We talk
I
our
remember.
paths a little funny.
I like when that accent comes out. Oh my gosh, because everyone knows my favorite retired hospice nurse is in Boston. So we give shots out to Boston.
That's great.
So anything else you wanted to share? I know when we first met, you were just I guess your daughter was getting married or son was getting married. I'm about to be mother of the groom soon. You who got married when we first met?
Oh my gosh, I have so much going on, Dr. G. This weekend is my daughter's bridal shower. Next
Uh-huh.
weekend, my son graduates from Dartmouth. He'll be my last one. I'll be an empty nester. And I became a grandma this past year. My son's in Hawaii. So, all three huge milestones. So
We
excited.
love that. We love that. Congratulations. So when we first met, I think it was Brenda Lee's party in 2023, and you were getting ready to be mother of the groom. You got any advice for me?
Oh my gosh, where do I start? Um, First, be yourself. You're lovely. Secondly, let the bride decide it all. Just sit in the
Okay, just
background.
say yes, ma'am.
Yes, ma'am. Um, it's we're not to have an opinion. We're just to love during that day. But no, seriously, just enjoy the day. It goes by so quick, and cherish every moment. So it was a beautiful milestone in my life.
Oh, I love that. Congrats. You have a lot of things to celebrate. So let's just jump in today. So, everyone, we are here to educate and empower and help you see what's needed to navigate the healthcare system. So, the story of the day is how I enjoyed the little party at the resale shop. Let's see, it was on May 14th, and I learned that all the funds from the resale shop supports the palliative care program. And so I thought it was so awesome to talk about that. And we're going to dig into what palliative care is and all that stuff. So yeah, we'll just go. So tell the people how much y'all raised last year and how that supports community.
Oh my gosh. Our resale shop, we're celebrating 45 years this year. This resale shop has grown to people in the community are talking about it. There's a buzz going on. And the reason is the mission behind it. People donate every day for the cause, and the cause is the seniors that live alone, the seniors that are at risk, seriously ill. Um, some insurance companies will cover palliative, and we'll get into that, I'm sure, but some don't. A lot of patients don't have the ability to access palliative care because their insurance provider doesn't cover it. For example, Medicare doesn't cover it. So, how do they gain access? Through charitable donations, and that's through our company, Hospice of the North Coast. We actually provide palliative care through our resale shop. Our resale shop raised $1 million last year, and it provided over 130 patients on average per month that care. It's incredible. Thousands of patients have gone through our palliative care system or program, and we have so many testimonies to share.
I love that. I love that. And I'll put the definition of palliative care, but if you had to explain what palliative care is, um, how would you describe it to someone who never heard that word, or they think, "Oh, is that hospice?" You know, because everyone gets scared of the H word. What would you? How would you define it in your own
I,
words?
I would say it's like putting on a comfortable blanket wrapped around patients with serious illness. It's aimed at making sure people are comfortable, pain free, and emotionally supported. It is for those patients that have chronic serious illness. And yeah, I'd say
Yeah,
that's it in a nutshell.
that's beautiful. And you know, it's I hate when I see some of my, colleagues online, some of them are influencers trying to educate the public and, an individual will go to the hospital and say, "Hey, I want palliative care." And the doctor will say, "It's not time for that yet." It's always time for palliative care. Hello, right?
Starts when you're diagnosed. When you're diagnosed with a serious illness, it's time to talk to your doctor about it because there's so many other things. It's not just pain management, it's all the psychosocial aspects of going through the journey.
Yeah. And the piece that's important, with palliative care programs that I've seen is the advanced care planning that goes into it. But we're in California and we know there's a lot of variability in programs. So we're just going to specifically talk about Hospice of the North Coast because they are a nonprofit hospice organization and they prioritize patient care. And in preparing for this, I learned that there's a difference between not for profit and nonprofit and all that craziness. So we're not going to talk about that today because we already covered that in a previous episode. I'll put a link to that. But I want people to understand, especially since we're in a federal moratorium right now, that they need to really do their research when they're having a serious illness so that you're not making a decision in a crisis. And Hospice of the North Coast and their palliative care program and all the things they're doing is a good example of what to look for.
Absolutely. Thank you so much.
Yeah. Yeah. So, what would you say to someone if they were like, what's the difference between palliative care and hospice? And when do we know that it's time to switch? Like, simply put, if we do take on that comfy blanket.
Um, when someone simply people can seek palliative care, which is I like to use the word supportive care services, right? And it's
That's good.
when you're still seeking aggressive treatment. For example, a simple example of that would be someone with cancer. They still want to go to their oncologist and go through chemotherapy. That's a great candidate for palliative care because sometimes they're experiencing pain and we want everybody to have comfort. Hospice would be when you say, you know what, no more. I'm done. I just want to live out my life with quality. And that would be hospice. That's the big difference, curative versus non curative.
Yeah, and a lot of people, they can see that for cancer, but for the other diagnosis, it's kind of murky for them. And so let's just do a little review, audience. Hopefully y'all have a copy of that Real Deal About Hospice. The purpose of that was to show you the different body systems that come to the end of chronic disease. So we have the brain, the neurodegenerative diseases that happen. We have the Alzheimer's, the different types of dementia. You may have had a stroke and repeated strokes, and that, makes you bedbound, or Parkinson's disease. We talked about that during Parkinson's Awareness Month. What's the next body system? Look, you have the heart, the most important organ.
Lungs.
Heart failure. We did that podcast. We talked with a cardiologist about that. So there's an end stage of that disease. And usually when you're in and out of the hospital, that's kind of a clue that you might be close. Then the lungs, COPD is like one of the number one underdiagnosed diseases of the lungs, and it comes to an end. Maybe you're in the hospital a lot for that too. An exacerbation, you're on 3 inhalers, you're on oxygen. Again, that comes a point when it's time to switch to hospice. And those folks actually plateau. I've seen it. Haven't you seen it?
Yes,
Because they're
yes,
getting close
yes,
care.
yes.
Yeah.
We see a
Yeah.
lot of
And
people. Mhm.
go ahead.
No, we see a lot of people plateau when they get the support they need. They rally.
hmm Yeah, and then the other body systems we could go on: end stage liver disease, end stage renal disease. You know, some people, there comes a point when dialysis is no longer effective, or when the liver disease is causing, you know, the stomach to swell. So review those things, so that you're aware. HIV is another one, but we don't see a lot of that since we have such great medications. But that's the reason we put that book together, so you're aware. And remember, we also taught you how to find a good hospice agency. Again, this is not about hospice, but palliative care is along the continuum. We're friends. There's an
Yes,
article about the friendship between hospice and palliative, and it is there, but there's a distinction. So thanks for sharing that with us, Lori.
of course.
You have that
Yes.
little handy educational piece, you know, for nonprofit versus not for profit. Maybe I can put a link in the show notes for them to look it up. But you have a leave behind there. You
Yes,
want
I
to wave it
do.
around?
Yes, I do. Right here. Can you see it?
Yeah. Well, we can't see it too much. Maybe I can get a PDF of it and put it, you know, as a download on my website. So maybe we could
Perfect.
do that. Yeah, we
We'll
can
be
do
happy to
that.
share that. Hmm.
Yeah, that's what we'll do. We solve the problem here. So yeah, so tell me about you know, some of the work that you all are doing. You said that thousands of people have gone through the program. Like, how do you all structure your palliative care program as a team base? Like, how do you all do it?
Well, first of all, they're heroes. It's a team of heroes. We have a palliative doctor who oversees and manages the pain. We have a two nurse practitioners. We have RNs, LVNs, social workers, counselors, spiritual counselors. We have a host of people and volunteers. So we are community based. We go to the home, wherever the home is, whether that's an assisted living, we could go to skilled if needed. Typically, we don't. We'll go to their home if they're in a hotel, they're homeless, living in or living in a hotel. We'll go wherever the patient is. If we have an address, we'll go. We look at the patient as a whole. Because again, this is about pain management, quality of life, comfort care, but it's also about the psychosocial part of the journey. It's a lot to take in when you get diagnosed with a serious illness or a terminal illness, and you're still seeking treatment. It's just a lot. So like I said, it's a comfortable blanket, right? We're going to wrap our arms around the blanket around these people. If you can visualize that, make them feel more comfortable, and support them along the way. What our program does is, with the money we raise and some of the Medicare dollars that we bring in through hospice, we provide, because we're not funded right now, we provide care through those means. And um, we want to make sure that we're supporting our community. This organization started within a community in Sanitas, and it's grown. We're one of the larger hospices now, and it's mostly word of mouth. And our palliative program is robust. People are talking about it. We have a very strong relationship with Scripps. They utilize us quite a bit. They have a clinic, but they don't really go to the community. We fill the gap. So when patients can't get to the clinic, we go to their homes. So we're an adjunct to them because we're not billing. We hope to get contracts, but it's hard when you're a small nonprofit, community-based, I should say, nonprofit, not a national company, to get those contracts. We would love those. I think if people looked under the hood and they saw our organization versus some of these other palliative programs out there, they would see that ours is so robust. It's like apples and oranges. Most palliative programs, because the funding is limited, they only allow telehealth, or it's Monday through Friday, 9 to 5. Ours is 24/7. That means weekends, that means nights. When patients are in crisis, it's usually at night. Someone has dementia, Alzheimer's, is sundowning, it's in the evening. They need support. They call us, we're there 24/7. We triage. If we can't do it over the phone, we send a nurse, all the time. Our readmission rate is so low. It's, people don't believe it. I'm like, it's true, because we go when they need us. It's very important. So when people ask and they start to research palliative programs, they need to ask specific questions. What's the team look like? Is it 24/7? You know, what do you specifically provide? How are you going to manage my complex illness? Can I tell a story?
Yes, you can do what you want. Thanks
Okay.
for that. I'm learning so much from this. Go for it.
Um, well, two stories. One, it ties into the resale shop. So, as you know, our resale shop is filled with donations. And when we get donations in, we set aside clothes for not only the homeless, but patients of ours, whether it's palliative or hospice, those that are in need. So the other day, I was at a skilled nursing facility. Hopefully, I don't cry. This woman was on palliative. She was really hospice appropriate, but she still wanted to get some treatment for her cancer. So, of course, we don't push. We said we meet them where they're at. She needed us. So, we met her. Anyways, she was bouncing back and forth. Her home was a sniff from the hospital. She was bouncing back and forth. In that, all her clothes were lost. She came back to the skilled nursing facility. She had no clothes. She was in a gown when I met her. And she said she was on our palliative program after all those back and forth. She was on our palliative program. Let me back up and say that. Um, and she was, we're talking to her about hospice. And she said, you know what I really need? And I said, what? And she said, I don't have any clothes. And I said, well, we have a resale shop. So the next day we brought in clothes, 4 outfits for her. Um, she lit up. She looked at me and she said, you are an angel sent from heaven. I can't believe, is this really for me? Are these really for me? And I said, yes, these are for you. And she says, let me give you money. And I said, no, 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 no money. These were donated. We're giving back. We're giving you these clothes. Well, the story continues in that she wore these clothes for the next, not even a week. She passed away. She passed away. She didn't even look imminent when I saw her, but she passed. And what I believe happened was she felt seen. She had dignity, respect. And she's like, it's time now. It's time to let go. And she did. Beautiful story.
It is beautiful, because people don't see this side of the work, because, we're just kind of doing it. But these are the thing that keeps us going. And please cry. I say when I stop crying, that's when I quit
Yes.
because that means my heart has gotten hard. And so that's the beauty. It's human work. It's sacred work. It's not glamorous. Um, but I'm sure in dealing with a nonprofit, organization, then you don't have the other stressors that is going on around. So again, audience, if you're listening, a family member that, been in the hospital a lot, or they may have a serious condition, maybe you can educate them because you don't want to make the decisions to go to the wrong place when you need help. You want to be with people like Lori. So thank you
Mhm.
for that story. Yeah, share
Of
that
course.
other that little bragging rights about the award that you all have received.
Sure. I was going to say the other story I had regarding
Oh,
the
go for it.
palliative program was um, a couple. This is a good picture of how palliative can support families. Husband, wife, I'm sure you've seen this, 90 years old. Wife's declining. She has Parkinson's. Husband, 90-year-old, doing all the work, doesn't have the means for caregiving. Um, they call us. Actually, he met us as he was donating to our resale shop. And we said, we have palliative care. And he said, I can't afford it. We said, no, no, we're going to be there. So we went, and it allowed them to stay in place. The support we gave, we also access resources for them. That's part of palliative. The social worker comes in and helps with resources. He was a veteran, so we're able to access that for him. It was just a beautiful story, and they're still together, and they're still at home, and they're on our palliative program. So I wanted to share that too, so people can see the type of people we serve in the community. Regarding what was the other question you just asked me? The
The
Oh,
award.
awards, yes. We just got our fourth award for Best in North County. We only serve a 35-mile radius, and the purpose of that is so we can get to our families as soon as possible. Again, we're community-based, but within that 35 miles, we serve over 330 patients, 200 on hospice and 130 on palliative right now. Um, so we're small but mighty. We do a lot of work, and those awards were gifted to us because people voted in the community and they said this company's been here almost 50 years and we see it, the work they do, and we're going to recognize it. So fourth in a row, 4 years in a row, we've won Best of North County, and we're so proud to share that.
Bravo, bravo. And that's a great story because again, my regular listeners, they know about, the World Hospice and Palliative Care Day um, guest we had on who unfortunately um, had some look that could make me cry. The hospital didn't let her know she could choose her own agency, and on a Friday night in traffic in Southern California, someone was trying to come to the Inland Empire from Ventura County. Like that shouldn't even happen. So again, these stories are heartbreaking. Isn't it heartbreaking?
It's, I hear it every day. It's heartbreaking.
Yes,
People,
people.
there's hospices up in LA serving San Diego. They put a satellite office down here and they say they have a hospice in San Diego, but they don't. So people need to know they have choice. Our logo on our website says your life, your choice, your way. They have choice. They can make their decision. Just I would say if they walk away with anything today, know that they're in control. I tell families this all the time. They can make their own choice. They need to educate themselves. There's tons of resources out there. Um, they have the decision until they take their last breath, period.
Amen to that. And I'm sure if someone peruses your website, first of all, if you look on the website, people, you can learn from it. I'm sure if they're outside the area, that the wonderful people there direct them in the right area.
Yes.
And yeah. And again, we have podcasts to help you research agencies, and especially important during this moratorium. And I would go as far to say, make sure you choose a nonprofit one if there's one in your area. So thank you for being our expert today and our valuable resource, Hospice of the North Coast. We learned about palliative care. I'll leave you with the last words before we sign out, Lori.
I just want to say thank you, Dr. G. You're doing great work out there. Our goal is to educate, teach people so that there's no fear around our life's process because we all are going to die someday. Just be informed. And I'm so grateful for you for having me on and just sharing your knowledge. So thank you.
Thank you. All right, we're signing out. Season 4. Peace.
Peace out.